This is very important for COVID-19. COVID-19 outpatients treatment overview. CDC, US CDC, Center Disease Control and Preventions. These pages provide treatment, healthcare provider, general public, COVID-19 treatment and medications. What do you need to know? There is strong scientific evidence. Antiviral treatment and outpatients, a risk of severe COVID-19 reduce the risk of hospitalization and death. Antiviral drugs, Ninomotovir with Ritonavir, Paxlovid, Remdesivir, Vicloris are the rapid treatment of legal adult pediatric patients who are at high risk for the progression of severe COVID-19. Clinicians should consider COVID-19 treatment patients mild to the moderate COVID-19 who have one or more risk factors. Severe COVID-19 treatment must be started early and effective. Risk factor of severe COVID-19. Clinicians can use the link below to identify patients at risk for the severe COVID-19 and who may benefit from the outpatient treatment. Severe outcome COVID-19 and defined hospitalizations, intensive care, ventilatory support, or death. There may be other medical conditions associated with severe COVID-19 are not listed in the clinical judgment. Age is most important risk factor, severe outcome COVID-19. Risk factors severe COVID-19 including ages over 50, with risk increasing substantially ages 65, being unvaccinated, are not being up to date COVID-19 vaccinations, specific medical conditions and behavior. Some people for racial ethnic minorities group risk being the disproportionately affected by COVID-19 from many factors, including limited access, vaccine, healthcare. Healthcare providers can consider this factor when evaluating the risk of severe COVID-19 use. So action healthcare provider can take a patient at high risk. Outpatient treatment for COVID-19. Although NIRMATREVIR, Nirmatrelvir with the RITONAVIR, Ritonavir, Paxlovid, okay. The clinical trial, Paxlovid reduced the risk of hospitalization and death by 89% unvaccinated. Outpatients with COVID-19 high-risk severe disease, serious adverse events are uncommon with the Paxlovid treatment. Paxlovid is given twice. Paxlovid given twice daily for 5 days, starting as soon as possible within 5 days. Symptom. It's approved for use as adult pediatric patient 12 years of ages older, weighing at least 40 kilo. Clinicians should be aware eligibility criteria and the potential drug interactions with used Paxlovid and may preclude. Paxlovid uses many required temporary discontinuations of other medications. COVID-19 rebound has been the report occurred in small percentages patients between the 2 and 8 days after initial recovery, characterized recovered by the milder symptom and the viral detection after having the test negative. For more information, viral rebound and the recurrence of COVID-19 symptoms. NIH COVID-19 treatment. Ritonavir, 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 boost. Nirmatrelvir, Nirmatrelvir, Paxlovid fact sheet for the healthcare provider. Emergency use authorization, Paxlovid for the treatment of COVID-19. Pax illegal, the legal checklist. Intravenous remdesivir, Beklury, Beklury. Beklury reduces the risk of hospitalization and death, 87%. Unvaccinated. COVID-19 high risk. 3 days courses. Intravenous remdesivir initiative within 7 days. Symptoms onset. Second preferred treatment option after Paxlovid for adult and pediatric patients. 28 days, weight 3 kilo. Alternative therapies when Paxlovid remdesivir are not accessible, clinically appropriate. Oral antiviral monopiravir can be used clinically. Can use the link below review. MOLNUPIRVIR fact sheet of healthcare provider. Monopiravir. The U.S. Food and Drug Administration has also issued an emergency use authorization permit of emergency use COVID-19 plasma with higher anti-SARS-CoV-2 antibody for the treatment of COVID-19 in patients with immune. This is very important for COVID-19. COVID-19 outpatients treatment overview. CDC, US CDC, Center Disease Control and Preventions. These pages provide treatment, healthcare provider, general public, COVID-19 treatment and medications. What do you need to know? There is strong scientific evidence. Antiviral treatment and outpatients, a risk of severe COVID-19 reduce the risk of hospitalization and death. Antiviral drugs, Nirmatrelvir with Ritonavir, Paxlovid, remdesivir, Beklury are the referred treatment of legal adult pediatric patients who are at high risk for the progression of severe COVID-19. Clinicians should consider COVID-19 treatment patients mild to the moderate COVID-19 who have one or more risk factors. Severe COVID-19 treatment must be started early and effective. Risk factor of severe COVID-19. Cleansing can use the link below to identify patients at risk for the severe COVID-19 and who may benefit from the outpatient treatment. Severe outcome COVID-19 and defined hospitalizations, intensive care, ventilatory support, or death. There may be other medical conditions associated with severe COVID-19 are not listed in the clinical judgment. Age is the most important risk factor severe outcome COVID-19.